Hello, my name is Daniel Stillwell. I'm the editor of the IFTA e-newsletter, and we have with us here in Spain at IFTA, Helena Garcia Lopez
Correct.
and Tatiana Melendez-Rhodes.
Melendez-Rhodes.
Melendez-Rhodes. Thank you so much. So we're going to talk a little bit about your work and what you do and some other things, but let's start off with who you are as professionals. So what kind of clinician do you identify as, and what does that look like where you work?
Mm-hmm. Do you want to?
Go ahead.
Okay. So my name is Tatiana Melendez-Rhodes. I am an associate professor at Central Connecticut State University.
Mm-hmm.
I am the master's program coordinator. Been for a couple of years now, and I have almost over 20 years of experience of clinical experience. So I have had the opportunity to work in different places, so inpatient, outpatients, clinics and agencies, private practice, hospitals. So
Wow, yeah.
it's been a very diverse experience.
The students probably love that.
Mm-hmm.
So nice.
And I'm Helena. My name is Helena. I do work as a mental health therapist here, currently practicing here in Spain, in Málaga.
Mm-hmm.
I also combine the clinical practice with teaching. I do teach psychology classes at the University of Maryland Global Campus,
Okay.
which is located within the naval base, the U.S. naval base in Rota, Cadiz.
Okay. All right. Well, then let's talk about your work, your presentation. So tell us a little bit about what you're focusing on and what hopefully you're being able to communicate to the people attending.
Sure.
Yeah.
So our presentation title is Working with Unaccompanied Immigrant Children in the U.S. So this presentation is the recollection of the experiences that we have had as clinician.
Mm-hmm.
So Helena and I, we have worked together for a few years, and we kind of like put together this presentation with the purpose of informing other clinicians about the importance of this work, especially very relevant for current times, and the work with trauma, and also the work that we as therapists we need to do when working with this specific population.
Nice.
And we also wanted to provide other clinicians with some skills or ideas about skills that they need to develop in order to do this job, this work with these children, based on our clinical experience and the challenge that we experience ourselves.
Okay. And I would imagine as systemic psychotherapists yourselves, you try to focus on the kids, on the larger family system, and even the infrastructure, the government, the laws of how everything works. How do you navigate all that?
Well, it is a challenge. You need to understand, or you have to understand the process they go through. Since these are unaccompanied children, they're put into custody, they're taken to hosting family, temporary hosting family. So they go through several steps, and it is quite challenging because it's about helping them to accommodate to all the process steps in the process they go through. And yeah, what else would you like to that besides just knowing the process they go through? And
well, first of all, the U.S. has some specific policies and so legal procedures. So we need to take a look at different systems, work with different systems. We work with a multidisciplinary team. So we're going to be working, for example, a social worker might represent the child, right? There are other children who are already living with a family. We have to be in interaction with the school system as well, sometimes with a psychologist, a psychiatrist, because we do not have access to the previous history of the child, physical and or mental.
Yeah.
So it is very critical to being able to navigate all of that. And sometimes, different professionals, have different opinions about what is going on with the child. So I think that that's when, our work also is critical to kind of like uh, help them, to understand the current situation of the child. No, I think that one typical example is the children so people try to have the children living a normal life, but what is normal?
Life.
Right.
Exactly, and like so they are sent to schools. Well, they do not know the language, they do not know the social norms, right? So sometimes they may exhibit some specific behaviors that might be taken as, from a pathological perspective. So that is the time which we need to have a conversation, and let them understand that it's just an expression of some, sometimes
Distress.
unresolved situation that they're going through.
Right. Yes, and so much of this is about the resilience of the child, but we want to also make sure that they don't have to be resilient. So how can we create the infrastructure to support them through the process? Now, I know that you were talking about the steps of the process, how knowing that and facilitating knowledge about that to the different interdisciplinary team is important. How do you also communicate the emotional or the developmental process that so many of these minors are going through, and what trauma does to that process for them growth-wise?
For the child,
yes.
You mean how to communicate, specific skills about how to communicate with them
emotionally and developmentally, since some of these journeys are years.
Yeah. One step at a time.
Okay.
Probably that would be the key. So for them, first I think it's about listening. Which are their needs, if they're able to communicate their needs.
Right.
Sometimes they're not. So creating an environment where they can actually feel safe and they can start building trust, so they can start sharing. And that's part of the developmental work that you need to do. Otherwise, nothing's going to develop.
Right.
So that's the beginning. And once they're able to open themselves a little bit, then you move on to the second stage, which is a little bit more helping them to accommodate to the next situation they're going through at that moment.
Right.
So one step at a time, I would say.
Okay.
Right. It is, I mean, we have, typical procedures that everybody else, goes through from the clinical perspective. So you have different kind of assessments, that evaluate multiple things like PTSD, anxiety, depression.
Right.
But we need to take into consideration that they might not be ready to have that, to engage in that process. So we look at development, right? So this might be a child who can express through play, right? Or drawing or movement or something. So we cannot have an expectation that there is only way of doing assessment, because you might not be able to get that done.
Absolutely.
So there needs to be some sort of flexibility in the way how you assess, analyze, and make some decisions for treatment intervention.
Well, I love the versatility of assessment and hopefully the versatility of treatment. Because it sounds like a lot of what the work is coaching and helping the other members remember to be compassionate and to listen with empathy before they immediately start fixing problems, because you don't know where the child is developmentally, emotionally, or logistically sometimes. Now, this also sounds like a good transition to the global scale, because we're talking about the U.S. immigration process, but I believe you also are working with issues around the refugee crisis in Eastern Europe, right?
Yeah, we're we discuss over this many times, and every process is different, every culture is different, so I'm sure that our clinical experience cannot be generalized to other crises in other places, but the emotional process and the elements of the emotional process might be the same or might be similar. So I do believe that there's some knowledge that we can take from the experience that can be transferred into interventions that might be valid and that might be useless in any other, or useful in any other circumstances. Well, yeah.
Yes, so, in looking at the literature and the research that has been conducted in different countries around the world, we can conclude, that the way how we approach, the situation, we can find some similarities. But what makes it different is the way how, people understand and express themselves. Because, culturally speaking, some specific cultures might be more inclined to express themselves verbally, and others might not be. There are cultures in which emotion is something that is spoken and shown, and there are other places in which emotions is actually a sign of weakness. So I think it's very important to take that into consideration, and one of the things that we talk about is to be culturally informed and culturally sensitive.
Correct.
Right?
Yeah.
So being able to move at the pace of the child, because we have this pressure, especially sometimes in agencies, okay, so this is the child who has PTSD or has some specific trauma involved. This is what you have to do, A, B, C.
Yes.
And that's not how this works.
Right.
So I think that it's important to have to take that into consideration. Otherwise, it creates, I think, frustration for everybody, and the only thing that is create some sort of resistance, and also creates an unsafe place. And we are advocating actually for the total opposite of that. We want safety in the room.
Yeah.
But in order for you to feel safe, you need to know that you can express yourself and be who you are without judgment or without, rushing and all those things.
When we discuss about this, we both agree on the importance of sometimes doing some kind of what we call as pre-assessment work. There has to be some work done before the assessment, because it's about helping the child to feel comfortable and safe. And once that happens, many of the symptoms that you might be acknowledging at that time, identifying at that time, might disappear or might decrease.
Right.
And that's when you are actually in a better position to conduct an assessment and see what actually is happening.
Yes, I think about the path analysis in research. Some people are at this dot on the way up, some people are at this dot on the way down.
Yeah.
And so getting those multiple assessment points is very valuable to treatment planning.
In reality, as a clinician, you are always assessing. You are assessing from the
Hopefully,
beginning,
yes.
right?
Yeah.
So all information is useful and is worthy. But we're talking about helping the child to feel comfortable and safe, so everything else can happen.
Right. Yeah. Just attachment theory made manifest. So that's perfect.
Absolutely. It's one that. So just think about a child, who engaged themselves in that journey of crossing from one country to another. So there is this separation. But then when you are in therapy and you ask them, what kept them going. So one of them might tell you something like, I had the voice of my mom in my head. I have this specific memory of what I used to do with my sibling and my parents there. So it's always this identification with this person who is not longer with them, but it's still they have this memory, this perception about of what their life used to look like and what they felt in those circumstances. So coming or going, to a different country, they lost that.
Right. Yes.
So that's connection. Not that they don't have capacity to connect, but they do not have that connection with the people that are representative for them.
Right. And it's very hard and very valuable work. Not only doing it, but helping train and support and coach up the others to do it at a larger scale. Now you are also working with some people in Ukraine. Is that correct? So tell me a little bit about
Correct. Yeah, I'm part of a research team who is currently conducting a research with pregnant and postpartum women, Ukrainian pregnant and postpartum women. So half of the team is within Ukraine.
Mm-hmm.
Some of the members of the team are in Poland and Germany, and some of the members are here in Madrid, and I am part of the team as well. And we are wanting to assess and analyze the risk factors and protective factors, as well as the prevalence of mental health disorders in this particular population, Ukrainian pregnant and postpartum women.
Mm-hmm.
We're at the stage of collating data.
Okay. Yes. Well, you definitely have a passion for the disenfranchised and the downtrodden. So that's fantastic. Thank you so much for bringing your energy, your wisdom, your compassion to the people who need it, and for training those of us who need to step up and be part of that process as well.
Thank you so much.
Thanks to you
For inviting us.
Yes, of course. Let's end with a slightly fun question. Both of you are familiar with Europe. What would be one of the places that you would tell everybody you have to go see this place?
Málaga. Well, no, I think Europe is beautiful.
Mm-hmm.
I have traveled to many places. It's beautiful. It's very different between countries.
Very diverse, yes.
It's very diverse, yes, and it's beautiful. Of course, I think everybody should come to Spain,
Mm-hmm.
because there's a good combination of people and culture and art and food, and so definitely Spain.
Mm-hmm.
But I think any place in Europe is so worth it to visit.
Okay. So pick a spot and dig deep and see what you find. I like it. What about you?
Well, I love Spain. I've been here like 4 or 5 times, I believe, and and in different places all over Spain. I've been very fortunate, to have this opportunity to travel. Another place that I really love is Italy,
Mm-hmm.
a lot. And in general, I like Europe, especially these areas, because it's very social.
Mm-hmm.
I love the fact that people are really outgoing, and as you can see, you go any time of the day outside, and there are people out there,
Yeah.
and like not too much rush,
Mhm.
doing to be on a schedule with things. The arts, I
Mhm.
think that there are places that is like an open museum, the street, and I like the combination of history, literature, arts, and all the beautiful places that you can see. I'm coming from a city, so for me, to be in places that have a city, I feel like home.
Okay.
So I do enjoy my time in Europe every time I can. So
Wonderful.
to be here.
Well, Tatiana, Helena, thank you so much for being here
Thanks to
and
Thank
for
you.
sharing us your work.
Thank you so much. I appreciate that.